Hi everyone. Today we will be talking about how to record vaccinations with our new vaccination feature in SystmOne. How you can find this feature is by one, going into the patient's record, and then right under where you're accustomed to seeing the child health record, you will see an area that says vaccinations. Sometimes it might be grayed out and sometimes it might be black. That's okay. You can document your vaccinations anyway. In order to access it, you do a single left click and you will see that your display area now says vaccinations, and you will see what is known as a childhood grid below. This childhood grid is an overview of all the routine vaccinations that children get in Jamaica, and these green ticks let you know that the patient has received this vaccine, and the yellow triangles let you know that the patient has not received that part of the vaccine. Right now, we'll go through a few scenarios that you might meet and how to record a vaccination in these different scenarios. The next part that we'll be covering in this video is how to use this vaccination feature in different scenarios that you'll meet with patients. So the first scenario is a patient who shows up with their vaccination card and you want to record whatever vaccines they got in the EHR for historical purposes. So for example, they received a pentavalent vaccine in 2000, part 2, and you want to reflect that on the system. So you want the system to say that the patient got a pentavalent vaccine and they got it in the year 2000. So this is how you do that. So right here, you can see that the elements of the pentavalent vaccine are laid out here in separate components. You also see that for part 2, there are the triangles, which means that the patient's vaccination status is not currently being reflected in the record. In order for us to reflect the patient's true vaccination status in the record, we can document that they got the pentavalent vaccine in the year 2000. And let me show you how to do that. So right here, right underneath vaccinations, we have a syringe icon. We can do a single left click, which will launch our record vaccination dialog box. Within this dialog box, we are able to record the vaccines that our patient received. The first thing that we want to do is to reflect the date and time the patient got this vaccination. And we do that with this section of the dialog box up here. So I can change this date, which currently says today's date. And I can say the patient had gotten the vaccine on the 1st of July in the year 2000. So we always want to make sure that this date section is reflecting when the patient got the vaccine. In our next area, we have some checkboxes that basically allow us to filter what options of vaccines that we have. So do we want to see the branded? Do we want to see the generic? Do we want to see the obsolete? As a default, I recommend that we check all these boxes so that we can see all the vaccines. Now, in our next section called the vaccination section, this is where we actually select the vaccine that the patient got. So I've mentioned pentavalent. So what we can do when we select this is a gray area, we can scroll through and look for our components of the pentavalent. You can see here that some of these components have brand names attached, whereas some components are generic. If you know what the brand name is and it's reflected here, you can always select that pentavalent associated with the brand name. But if not, you can also just select the generic. You'll note that you actually have different components available. So you have ones with the IPV reflected, you have ones without the IPV, for example. So you can select the ones that apply to you. You have even DTaP versus DTWP. So you can look through these different options and see which one applies to the patient. In this case, I'll be selecting the generic option. And once I do that, if you notice in my part section, it automatically says part 2. However, I can also click on the part 2 to change what part is actually being reflected. In my contains area, it will tell me what this vaccine contains. So this one contains BPT, hepatitis, HIV, pertussis, tetanus, as well as IPV. I can also put in a batch number, as well as an expiry date. And I can also put in the dose. Now, some of these things were already added for you automatically, but if you wanted to adjust them, you can. I can also select the reason for the vaccine. For example, if it's a routine measure, if it's for pregnancy, a special risk group, or a traveler, or an epidemic. I can also select the site of the vaccine. So for example, did they get it in the right anterior forearm, left anterior forearm, orally, nasal, left lateral thigh, etc. And I can select the method, which is if it was IM, deep subcutaneous, intradermal, etc. I can also add any notes. For example, if the patient had any adverse reactions, I could add that here. In this case, my patient had nil adverse reactions, so that's what I'll be documenting. You also have an option to include whether or not a parent was present at the time of the vaccination, as well as to record consent. Now, you have some other areas of this dialog box that are not necessary for you. For example, there's an area that says jar supervisor, nature of risk, protocol, and area. These are things that are not applicable to how we document vaccinations out here, so you can leave them blank for now. When you're finished, you have two options. You can select OK, or you can select OK and another if you want to record yet another vaccine. For these purposes of the demonstration, I'll just select OK. Now, if you notice, my childhood grid has changed. So now in part 2, where there used to be yellow triangles, you now are seeing check marks, which indicates that the patient did receive these vaccines. And if you hover over the vaccine checkbox, you can actually see what parts of the vaccine were given and when the vaccine was given and who documented it. And that is how you record a historical vaccination. So to recap, what we looked at is 1, how to find our new vaccination feature. And you find it right underneath the child health record in your clinical tree. The next thing we looked at is how to read our childhood grid, which is the grid of routine vaccinations for Jamaicans. And we looked at the fact that if the patient has a green tick next to a vaccine, that means that it's been recorded as having being received. And if they have a yellow triangle, it means that the vaccine has not been recorded as being given. We also looked at how to add vaccinations, which is using our syringe icon here. And we looked at using the record vaccination dialog box, where we can go through the vaccination that we want to record, the part, the batch number, the expiry date, dose, reason, site, method, and any notes that we want to add. Thank you very much for watching, and please stay tuned for part 2, which will cover how to record a vaccine that you just administered.